time, and we'll start on or around time. Good morning, ladies and gentlemen. Good morning, distinguished heads of delegations, ministers. And we'll start our day's session with the report of the Committee on Credentials. And we are going to ask the delegation of Botswana to present that report. Please let's settle so that we listen. It's part of the transformation agenda that we keep time and we do things the right way. So the delegation from Botswana, please.
Thank you, Chairperson. Good morning. The Regional Committee appointed representatives of the following 7 countries as members of the Committee on Credentials: Benin, Botswana, Kenya, Mali, Togo, South Africa, and Uganda. The Committee on Credentials met on the 28th of August 2016 and elected myself as its chairperson. 30 credentials were formally signed in original and were reviewed by the committee, as well as 1 provisional credentials from Zambia. The committee mandated its chairperson to examine and report to the Regional Committee on its behalf any credentials submitted after the meeting of the committee. Subsequent to the meeting of the committee, Angola, Comoros, Liberia, Mauritius, Nigeria, Seychelles, Sierra Leone, and Zambia submitted formal credentials. The following member states have not yet registered: Chad, Ghana, Equatorial Guinea, and Swaziland. The following member states have been confirmed as not attending the Regional Committee, and these are the Central African Republic, Guinea-Bissau, Mauritania, Rwanda, and South Sudan. I submit. Thank you, Chairperson.
Thank you, the delegation from Botswana, on that report on the Committee of Credentials. We will now consider document AFR/RC67/187 on WOH's 13th General Program of Work, the draft concept. And at the request of the Director General, all regional committees will consider the draft 13th General Program of Work. And I would like to remind honorable delegates that the DG has just been elected by the World Health Assembly and will have to quickly put together the next GPW that will guide the work of the organization for the period 2019 to 2023. A draft concept note is therefore being presented to all regional committees, together with wide consultations with all member states, non-state actors, and staff of the Secretariat. I'll now pass the floor to Dr. Jean Okwelo Bele, Director for Immunization, Vaccines, Biologicals at WHO headquarters to present this agenda item. Dr. Okwebele, you have the floor.
Thank you, Chair, and good morning. Honorable Ministers and Heads of Delegations, Regional Director, distinguished participants, I'm pleased to introduce the draft concept notes towards WHO's 13th General Program of Work for the period 2019-2023. This document was posted on the website of WHO late last week, which we do recognize did not give ample time to delegates to review it. So the next slide, please. The session this morning is intended to kickstart the consultation process with member states. We would like to inform you and hear your views about the proposed process leading up to the adoption of the 13th General Program of Work. We would like to hear your views about the general direction and the emerging priorities of the draft concept notes, and we would like to get your agreement about the proposed next steps, especially about convening a special session of the Executive Board in November. Next slide, please. Before going into details of the content and process of the next Global General Program of Work, let me remind ourselves that the General Program of Work is a constitutional requirement. Article 28, paragraph G of the Constitution requires the Executive Board, and I quote, to submit to the Health Assembly for consideration and approval a General Program of Work covering a specific period. So from this definition, it's clear that while there is no specific format, no time period set, the GPW is owned by the member states. It serves as WHO's strategic framework, providing a broad general policy direction for the development of detailed biennial programs. It helps to clarify defined programmatic objectives for the work of the organization, and it outlines a longer-term perspective on challenges to health and the measures required to overcome them. The GPW is also WHO's main instrument for accountability and transparency. And lastly, it serves as the basis for our strategic resource mobilization efforts. This slide shows a graphic representation of the WHO's strategic planning process. You will note that the biennial program budget build on the GPW and are guided by the directions set in there. More concretely, the budget allocation and prioritization decisions reflected in the program budgets are driven by the GPW. So in fact, the program budget is the implementation plan of the GPW for a given 2-year period. Next slide, please. Prioritization in WHO is a complex and challenging exercise. And I think we heard a lot about the difficulty of doing prioritization yesterday afternoon in this room. I would like to also say that it took nearly 2 years to develop the previous GPW, agree on the key priorities. But this time, our task is somewhat easier. The SDGs, which reflect a broad consensus by member states, set the key parameters for WHO's focus and priorities leading up to 2030. SDGs have to be the main organizational framework for our work, and the GPW needs to be WHO has to show how it's going to support the implementation of SDGs so that countries can achieve the SDGs. The GPW 13 is also shaped by the DG's vision. Our DG was elected on a platform of 5 leadership priorities, which have to be reflected in the GPW. In addition, the DG received high-quality ideas for change following a call he made to all staff at all levels of the organization immediately after taking office. And he himself talked about this so wonderfully yesterday in his speech. He also received proposals from external partners and experts, and he has taken the time to review the 3rd stage evaluation of WHO reform. And finally, there are important ongoing commitments set by the World Health Assembly and regional committees which need to be carefully reviewed and respected. The transformation agenda being implemented in the African region reflects a strong commitment by the regional committee, and the key elements of such a powerful regional strategic initiative should be reflected in the GPW 13. Next slide, please. So let's now review the 6 operating principles for WHO as proposed in the draft concept note. What is it that WHO will do differently? It's proposed a focus on outcomes and impact, because outcome and impact place people at the center of WHO's work as compared to a focus on outputs. Full alignment with health-related SDG targets and indicators. The setting of clear priorities that are followed through, including when it comes to making tough decisions on the alignment of the budget to the priorities that are set. It's also proposed that WHO will become more operational, especially in fragile, vulnerable, and conflict states, while at the same time strengthening the normative and technical functions. Placing countries squarely at the center of WHO's work, because results occur at country level, and in that context, country offices have to be fit for purpose, sufficiently funded, and with increased delegated authority. Finally, providing political leadership, which suggests the need to reach out to political leaders and heads of state, including through opportunities to address key political forums in order to highlight the world's health challenges. Next slide, please. The draft concept note contains the evolving strategic priorities, and these are very much initial ideas for your consideration, but we believe they provide a useful framework for organizing the work of the organization. First is about prevent, detect, and respond to epidemics. WHO's goal is to prevent outbreaks from becoming epidemics and prevent excess mortality and morbidity when emergencies occur. WHO will work to strengthen the capacity of national authority and local communities to detect, prevent, and manage health emergencies, taking an all-hazard approach. Second, provide health services in emergencies, help operate and restore health systems. Third, help countries strengthen health systems to achieve universal health coverage. Fourth, drive the progress towards the health-related SDGs. In fact, WHO recognizes that some of the most significant health gains originate in policies from sectors outside health, and in this sense, all SDGs actually are health-related. Fifth and last, provide the world's platform for collective decision-making in health. WHO is the world's only intergovernmental body covering the full spectrum of health issues. Global risks need to be addressed through global collective action and the production of global public goods. So, in that sense, WHO's governance platform is the place where this occurs. Next slide, please. This slide shows a mock-up framework. It's an attempt to bring all the elements of the draft concept notes together, from strategic priorities to WHO's mission and vision, while highlighting the enabler functions, and also proposing, as you can see, some clear, measurable impact targets. So this is very much a work in progress, and a finalized version of this framework will be part of the next iteration and hopefully part of the final version of the general program of work. Next slide, please. So in terms of timeline, we're proposing that the new GPW covers a period from 2019 to 2023. These would facilitate that the two next program budgets 20 to 2021 and program budget 22 to 23 are built on it. In terms of process, we are suggesting that the next GPW is approved at the next Health Assembly in May 2018. You may remember that last time both the PB 14-15 and the 12th General Program of Work were adopted at the same time, and that did not allow sufficient preparation and realignment. We believe that it would be beneficial for the organization to have 1 year to fully align the new PB program budget 2021 with the direction of the 13th General Program of Work. In addition, resource mobilization efforts could start now and be pursued in time, and more strategic, and we could then have much better alignment in the way we do our planning processes. Last slide, please. In order for the Health Assembly to be in a position to adopt the 13th General Program of Work in May next year, we would like to suggest the following steps. The draft concept notes would be discussed by the various regional committees between now and mid-October. During the same period, informal web-based consultation on the concept notes will be undertaken for member states and other stakeholders. Then the Secretariat will publish the draft 13th General Program of Work on the 1st of November. A special session of the Executive Board could be convened to discuss the draft should Member States request to do so, and this could be done on 22nd and 23rd of November. Then in January 2018, the Executive Board will consider the 13th General Program of Work. And in May 2018, the Health Assembly will consider the 13th General Program of Work for endorsement. I would like to thank you very much for listening.
Thank you, Dr. Okwebele. The floor is now open for discussion. Perhaps just keep these next steps on the what do you call it? On the projector, so that we can refer to it. But I think this is an important document. The Director General has set 5 priority areas and also has emphasized the transformed WHO. And you can see those next steps there. And let's just discuss as the regional committee. You can see the first one actually says regional committees to discuss between 28th of August and 13th of October. And I'm assuming that we've read this paper so that our contributions are apt. So the floor is now open for comments on this document as well as the process of consultation for the development of the 13th GPW. Any comments? Benin? Seems to be all. Yeah, there's one at the end there. Liberia? I know you're warming up. When you do warm up, you will be overwhelmed. But for now, let's start with Benin.
Merci, Monsieur le Président. Je voudrais d'abord transmettre les salutations du ministre de la Santé du Bénin, qui n'a pu être ici pour des raisons indépendantes de sa volonté. Monsieur le Président, je voudrais aussi vous remercier pour l'accueil et surtout pour la cérémonie d'ouverture qui a été présidée par Son Excellence le Président de la République. Je saisis l'occasion pour féliciter la directrice régionale pour son rapport d'activité et pour le programme de transformation qu'elle a engagé. J'ai retenu que ce programme met l'accent sur la gestion assez sur les résultats. Le constat aujourd'hui, c'est que nos systèmes de santé sont faibles et ne parviennent pas à faire face aux défis actuels. C'est pourquoi nous saluons et soutenons la vision, la mission et la stratégie de l'OMS pour le 3e programme général de travail 2019-2023. Notre pays, le Bénin, a entrepris un processus de réforme profonde de son système de santé. Ces réformes sont organisationnelles, institutionnelles et surtout fonctionnelles. L'objectif pour nous est de mettre en place un système de santé capable de nous conduire vers la couverture santé universelle. Nous sommes soutenus par le bureau Bénin de l'OMS et je voudrais profiter de cette occasion pour dire que le Bénin soutient le calendrier qui a été proposé pour l'adoption du 13e programme général de travail de l'OMS. Et nous sommes prêts à y contribuer pour son amélioration, pour qu'elle reflète davantage les aspirations des pays. Merci.
Thank you, Benin, for supporting the roadmap for the general program of work. Liberia, you have the floor.
Okay, thank you. Good morning to all, and we are very excited to be here and want to say a big thank you to the organizer. We have had a wonderful time since we got here. Again, we want to express our thanks and appreciation to the DG for setting up this path, which is going to help us to begin to tackle some of the issues that we have as it regards to health within our world. The roadmap is very, very important. Important in that it has delineated some of the issues that have affected us as a world body. I think one of the best things to do to help us implement this is basically the burden of diseases, the burden of epidemics, many a times focuses in different regions. And I think within those regions, there are technicians within those regions that understand the complexity of some of those issues. And if they can be brought together to discuss it so that at the end of the day, the process begins from the people, and the people become part and parcel of having it as an ownership in order to make sure that its implementation becomes easier. Again, we want to say a big thank you, and we look forward to the roadmap, and we are willing to contribute at every step. Thank you.
Thank you, Liberia, for endorsing the issue of consultations. That is really welcome. Any other contribution from the floor? Well, we had assigned 1 hour for this particular item. We felt it was important, but clearly member states are content. So, South Africa.
Thank you. Thank you, Chairperson. I don't think we are content, Chairperson. We are still thinking because, as it was said, we received this document a bit late, and it's not a very simple document. It's very far-reaching and very important. I'm wondering, Chairperson, whether I'll be out of order. Because this is a program of action. A program of action for the next 5 years, if I'm not mistaken. Will it be wrong if, because of that, you give us a little bit of chance until this afternoon and you swap the programs? There are quite a number of things here which by themselves can take the whole day. For instance, this issue of universal health coverage, I've been asking exactly on the African continent, how do we want to achieve it? Because you know there's already a pushback. If there could be a pushback in a powerful country like the United States, just imagine what will happen in our country. So I would like to come and give some inputs on that, and I believe, even though colleagues didn't send me to speak on their behalf, they are not speaking because we believe this document is finalized. We just didn't read it. At least I didn't. And I'm struggling to go through now. That will be the proposal, Chairperson, if it's accepted. If it's not, then I'll try with the little understanding I'm having to give some input. But it's going to be very poor.
Thank you, South Africa, for trying to defend not reading it. But Congo?
Merci, Monsieur le Président. Le Congo tient à féliciter donc le secrétariat pour l'initiative prise en ce qui concerne la démarche qui doit conduire au programme de travail de la période 2019-2023. Cependant, nous sommes préoccupés par les délais. Nous sommes déjà le 29 août aujourd'hui et que les consultations au niveau des États doivent débuter le 28, donc jusqu'à la période d'octobre prévue. Et ce qui fait que certains défis des États qui doivent s'aligner sur les programmes gouvernementaux nationaux pourront certainement ne pas être pris en compte dans le cadre de ce programme, puisque nous notons bien dans le processus de transformation de l'OMS, pris en tête par Madame la directrice régionale et Monsieur le directeur général, pour lequel nous nous félicitons, il y a des défis importants en termes de gouvernance, étant entendu que l'assiette sur les problèmes majeurs de santé dans nos pays sont importants. C'est la raison pour laquelle, comme c'est un programme qui peut être ficelé sur une période assez longue et pour lesquels les mobilisations budgétaires seront également donc prises en compte, nous sommes inquiets au cas où éventuellement il y avait certaines priorités au niveau étatique qui pourraient être prises en compte dans ce programme. Comment les rattraper dans le cadre d'une période, dans le cadre de ce calendrier prévu et qui risque donc d'extirper certaines priorités. Donc nous manifestons des inquiétudes réelles en ce qui concerne le calendrier, les étapes à suivre pour permettre aux États d'inclure certains éléments de priorité dans le cadre de ce programme de travail. Et que, puisque les délais pour la partie au niveau des États devaient s'arrêter au mois de novembre, et nous souhaiterons le secrétariat nous répondre clairement pour dire s'il y avait des éléments à rattraper, comment faire, étant entendu que c'est un plan qui prend près de 4 années et que s'il y avait des priorités au niveau des États en termes de maladies spécifiques, comment les États devaient s'en prendre pour essayer de rattraper et faire que l'OMS puisse appuyer les États dans le cadre de ce programme de travail. Donc, pour résumer, pour dire, Monsieur le Président, ce programme de travail, il est bienvenu, la périodicité, elle est bien annoncée, mais nous pourrons être inquiets en tenant compte du fait que nous ne savons pas ce qui peut se prévenir, qui peut survenir en 2020, 2021, et comment faire pour qu'on puisse rattraper cela dans le cadre d'un cadre de priorité globale. Je vous remercie, Monsieur le Président.
Thank you, Congo. I think you are essentially agreeing with my colleague from South Africa there. Kenya, you have the floor.
Thank you, Mr. Chair. We wish to thank the DJ for this very well thought, strong and powerful general program of work that is going to give WHO strategic directions in the next 5 years. However, Mr. Chair, we needed to have adequate time to review and analyze further this document. We take note of the powerful and strong priorities that this program of work has proposed, and more importantly, on how WHO is going to support the prevention, the detection, and respond to epidemics. Mr. Chair, most of the times the health sector is called upon to respond to outbreaks that originate outside the health sector, especially where you have the poor sanitation, where you have environmental situations. We need, Mr. Chair, a very well thought out program budget that will assure resources are effectively utilized. We therefore support this roadmap submitted to us or to member states, and we take note. We've been given also ample time and chance to contribute to this concept note. So, Mr. Chairman, we support the roadmap. Thank you.
Thank you, Kenya, for putting out the issue of the budget. And the United Republic of Tanzania, you have the floor.
Thank you very much, Chairperson. I have asked you to take the floor to support a proposal put forward by South Africa. This is a very important program, an important document which is going to govern our work for the next 5 years. So we would also like to request time to go through the document in order to provide our input. Thank you very much, Chairperson.
There you have it, South Africa. There is support there. I think that yeah. Which nameplate is that one? Sierra Leone. Sierra Leone, you have the floor.
Thank you very much, Mr. Chair, and I want to congratulate the DG for a well laid out document. I just wanted to share with you in practical terms what we have experienced as a country that has been disaster prone for a period of consecutive periods of time. Where we have faced difficulties is the readily availability of resources. We have discovered that whilst the WHO may have resources, it is normally very, very difficult to have it practically ready when disaster or outbreak happens. So the statement that WHO will become more operational, I think you need to think about how to make the support readily available at the time of need. Thank you.
Thank you, Mali. What we can read now is that there's a proposal that has been made by South Africa, seconded by United Republic of Tanzania. And can we ask, therefore, the Secretariat to just rearrange time so that perhaps we look at this tomorrow, we give people time to read South Africa, like you have said, and seconded there, so that we don't continue to talk about the same thing and yet at the same time come back to it. So can I ask the Secretary to just rearrange the agenda and so that we can look at it maybe later on tomorrow? So can we go to the next agenda item? Sorry, Botswana, but I think you still want to say something? Okay.
Thank you, Mr. Chairman, for indulging me. I wanted to say something because I think when we read it, we must all know what we are reading. Now, when I read this, I didn't think it was something that was cast in stone. When I read it, there's a specific paragraph there that says the purpose of this is to stimulate discussion so that it can form a basis of consultations with member states, etc. Maybe the advantage is that I read the document. And then when you go, sorry, my brother from South Africa. No, he's my brother, so you won't mind. The other thing is when you look at the broad strategic objectives, they're really very broad that you can also internalize them at own member state level. I didn't think it was tying my hands to something. So the context of when we read it is important. So maybe if the Secretariat, when we can just reiterate what is it that you are going to read so that they can assure member states that they are not necessarily tying themselves to something that they cannot deliver on. So give us that broad direction so that when we read, we know what we are reading and for what purpose. Thank you, Chair.
Thank you, my sister there from Botswana. I think essentially you've done it well, that you've made us psychologically say to ourselves it's easy to read. So we will read it and reschedule it for tomorrow. I think we should go to the next agenda item. Dr. Akola Bello, I think we'll just postpone your response until Regional Director, you wanted to say something?
Thank you, Chair. I wanted to say two things. First, as guided by the Chair, we will indeed reorganize the program of work so that we give time this afternoon and overnight for people to have a look at this document. We do acknowledge it was circulated at the last minute because the timeline is so intense for this development. And secondly, just to say that it's been stated that this is a preliminary document. It is not final. But I think the broad lines and the principles that are stated in it are what initial comments are being requested upon. The details, I think, can be discussed at a later stage. So this is a first, quickly done version of a document. I think just to remind member states, we had a good reform of the election of the DG. One of the consequences is that the incoming DG has a very short transition time to prepare their ideas and to put them into the process of the system. Hence, the very short timeline in which you are receiving this document. But I think the idea is broad lines, initial ideas, it's not cast in stone, first comments, and there will be opportunities later on to drill down in detail. And then I think what was really key was to get comments on the timeline, the roadmap, so that some actions need to be taken in order to organize this process. Just to clarify that. Yeah, we will also share with you today the PowerPoint presentation that Dr. Okobele used, which then, in a more structured, briefer way, gives the main headlines and can perhaps make the reading easier and quicker. That's what we're saying. So we will, before the end of the day, circulate a revised program of work reflecting how we're going to take this on board early tomorrow. Thank you.
Thank you, Regional Director. I think that's clear. In fact, we had scheduled that after this agenda item we go for tea, but clearly people are coming from tea, so we'll go to the next agenda item, which is agenda item number 6 on the statement of the chairperson of the program subcommittee document FR/RC67/3. Dr. Thomas Samba, chairperson of the program subcommittee, will give us this paper. So it is my pleasure to give you the floor. Dr. Samba.
Thank you, Mr. Chair. His Excellency, the Director General of the WHO, Dr. Tedros, Excellency, Regional Director of the WHO African Region, Dr. Committe, Honorable Ministers of Health from member countries, Honorable Chairperson of the 67th Regional Committee for Africa meeting, Honorable members of country delegations, health professionals and technocrats from the UN Family and African Union, development partners in healthcare delivery, security personnel, members of the Fourth Estate, distinguished ladies and gentlemen. It gives me great pleasure to go through the course of this statement of the chairman of the program subcommittee PSC. The report, which is in your files, is essentially divided into 3 sections. Introduction, that is paragraph 1, opening remarks, paragraphs 2 to 5, and technical and health matters, paragraphs 6 to 18. The first 2 parts will be read in full. However, the technical and health matters will only be highlighted by key issues. The program subcommittee met in Brazil, Republic of Congo, from 13th to 15th June 2017, and was chaired by my humble self from Sierra Leone. The meeting reviewed 11 documents on the public health matters of regional concern that will be presented to the 67th session of the Regional Committee. This statement summarizes the main outcomes of the meeting. Opening remarks. The Regional Director, Dr. Mashidushu Moeti, welcomed all participants, particularly the members of the PSC who were present at the meeting from Ethiopia, Guinea-Bissau, Kenya, Mauritania, Namibia, Niger, South Tome and Principe, Seychelles, South Africa, Sierra Leone, South Sudan, Swaziland, Uganda, and the United Republic of Tanzania. She warmly welcomed members of the WHO Executive Board from Algeria, Benin, and Zambia, as well as representatives of the African groups of health experts in Geneva-based missions, whose presence will facilitate effective linkages between the debates and policies proposed at regional and global levels. Dr. Moeti took the opportunity to congratulate member states of the WHO African region for the election of the first African WHO Director General, Dr. Tedros Adhanom Ghebreyesus from Ethiopia. She thanked the coordinator of the African Group of Health Experts in Geneva-based missions for efficiently organizing the African group during the 70th session of the World Health Assembly. She then pointed out that the terms of reference of the PSC as adopted last year had been expanded to include, inter alia, oversight of the implementation of the program of work of the regional office. She ended by briefly outlining the important documents to be reviewed by the PSC, which included strategies and regional frameworks based on global strategies as well as other matters of public health importance. Ms. Patricia dos Santos from Angola, the coordinator of the African Group of Health Experts in Geneva-based missions, thanked Regional Director for inviting them. She congratulated the Regional Director for articulating a very rich agenda that includes documents addressing important public health matters in the African region. The PSC elected its chairperson, Dr. Samba from Sierra, that's my humble self, and its vice president, Dr. Maria Tome Palmer from Sao Tome and Principe. It adopted the agenda and requested the inclusion in the agenda of future PSC meetings a briefing on the latest World Health Assembly, as well as items on audits, risk assessment, and human resources. Technical and health matters, as said inter alia, only highlights, key points will be highlighted. The PSC discussed the document entitled Implementation of the Transformation Agenda. The Transformation Agenda is a vision to accelerate implementation of WHO reform in the African region by fostering results-focused values, evidence-based technical focus, responsive strategic operations, and effective and efficient partnerships and communication. The PSC commended the Secretariat for a series of notable accomplishments such as good progress, introduction of KPIs, conduct of independent evaluation, information sharing, and resource collection from partners. Following a very detailed technical deliberation, the members of the PSC recommended that the revised document entitled Implementation of Transformation Agenda be considered by the 67th session of the Regional Committee. The PSC discussed the document entitled Regional Strategy for the Management of Environmental Determinants of Human Health in the African Region 2017 to 2021. The document highlights the fact that 23% of premature deaths in the region are attributable to unhealthy environments. It builds on progress made in the implementation of the Libreville Declaration and recent developments, including the Sustainable Development Goals. The PSC highlighted the need to urgently undertake relevant interventions with emphasis on multi-sectoral collaboration, public-private partnership, and empowering communities, as well as advocacy at the level of heads of states of the African Union for a successful response. Following a technical deliberation, the PSC recommended the amended document, Regional Strategy for the Management of Environmental Determinants of Human Health in the African Region 2017 to 2021 for consideration by the 67th session of the Regional Committee. The PSC reviewed the document entitled Global Health Sector Strategy on Sexually Transmitted Infections 2016 to 2021, Implementation Framework for the African Region. STIs are a highly endemic public health challenge worldwide. With 63 million cases, that is 18% of the global incidence in 2012, the African region is particularly affected. To respond to this high burden of disease, WHO has developed a global health sector strategy on STIs 2016 to 2021 with the goal of ending STI epidemics as a major public health concern. The PSC suggested the use of appropriate language to allow countries to determine their key populations and also use existing opportunities for HIV to address STIs. Following relevant technical deliberations, the members of the PSC recommended the amended document Global Health Sector Strategy on Sexual Transmitted Infections 2016 to 2021, Implementation Framework for the African Region for consideration by the 67th session of Regional Committee. The PSC reviewed the document entitled Framework for Implementing the Global Strategy to Eliminate Yellow Fever Epidemics, EYEI, 2017 to 2016 in the African region. Yellow fever remains a challenge for public health in Africa, despite the availability of a vaccine that confers life immunity. Noting that the document was timely, the PSC recommended that it should be presented in a more compelling manner to urge member countries to implement cost-effective yellow fever prevention and control measures to reap the health gains. Following relevant technical deliberations, the PSC recommended the amended document Framework for Implementing the Global Strategy to Eliminate Yellow Fever Epidemics 2017 to 2026 in the African region for consideration by the 67th session of Regional Committee. The PSC discussed the document entitled Reducing Health Inequalities Through Addressing Social Determinants of Health. The document articulates some of the health inequities related to social determinants of health in the African region and the actions required by member states to reduce them. The PSC suggested the content of the document to be reviewed to enrich it in terms of aligning it with existing documents and also to align it with the SDGs and universal health coverage. Following fruitful technical deliberations, the members of the PSC requested that the amended document Reducing Health Inequities through Addressing Social Determinants of Health be resubmitted for review by the PSC prior to the 67th session of the Regional Committee. The PSC reviewed the document entitled Framework for the Health Systems Development Towards Universal Health Coverage in the Context of Sustainable Development Goals in the African Region. Health system strengthening is key to making progress towards universal health coverage and the SDGs. The PSC suggested that the language be simplified to make it more user-friendly. Subsequent to relevant technical discussions, the members of the PSC recommended the amended document Framework for Health Systems Development Towards Universal Health Coverage in the context of Sustainable Development Goals in the African region for consideration by the 67th session of the Regional Committee. The PSC reviewed the document entitled Framework for the Implementation of the Global Strategy on Human Resources for Health, Health Workforce 2030 in the African region. The framework makes the case for investment to strengthen human resources for health, HRH, which are critical for the attainment of universal health coverage and the SDGs. The PSC suggested that realistic reference be made to relevant documents in existence. The PSC further recommended the use of data explicitly and the need to strengthen human resource for health observatories and improved retention and protection of health workers. After fruitful technical deliberations, the members of the PSC recommended the amended document Framework for Implementation of the Global Strategy on Human Resources for Health, Health Workforce 2030 in the African region for consideration by the 67th session of the Regional Committee. The PSC discussed the document entitled Regional Framework for integrating essential non-communicable disease services in primary health care. The document aims at providing guidance to member states on the integration of essential non-communicable diseases (NCDs) interventions in primary health care in order to scale up promotive and preventive measures as well as early detection, diagnosis, and treatment. The PSC appreciated the relevance and timeliness of the framework. It requested that the challenge of industry interference in NCD control be highlighted. It equally suggested including in the framework long-term care needs, economic gains from tackling NCDs, community engagement, and NCD determinants in all national surveys. The members of the PSC recommended the amended document Regional Framework for Integrating Essential Non-Communicable Diseases Services in Primary Health Care for consideration by the 67th session of the Regional Committee. The PSC reviewed the document entitled Status Report on the implementation of the Decade of Action for Road Safety in the African region. Road traffic specific death rates in the African region are persistently higher than global averages. The PSC suggested the need for strengthening legislation and its implementation to be enforced. Following effective technical deliberations, the PSC recommended the amended document status report on the implementation of the Decade of Action for Road Safety in the African region for consideration by the 60th. The inclusion of data on the status of clinical trial cities and the region for a specific period, and the sharing of experiences by member states on the benefits of participating. It also suggested the inclusion of capacity strengthening of countries for the conduct of cities, including support from member states with the relevant capacity. The PSC also proposed referencing recent World Health Assembly resolutions on cities to demonstrate the alignment with global initiatives. Members of the PSC suggested that regular cities be distinguished from those carried out during public health emergencies. The PSC members recommended the amended document Status of Reviews, Authorization and Oversight of Clinical Trials in the WHO African region for consideration by the 67th session of the Regional Committee. The PSC discussed the document entitled Regional Orientation on Implementation of the World Health Organization Program Budget 2018 to 2019. The program budget 2018-2019 was developed in the broader context of WHO reform and is the last within the 12th General Program of Work 2014 to 2019. The PSC suggested including issues related to the funding gap, vision of the polio transition plan and delayed direct financial cooperation DFC reporting. It also underscored the need for the Regional Committee to discuss ways of encouraging member states to honor their commitments in a timely manner in order to increase their assessed contributions. It further stressed the need to mobilize additional resources, including from private sector, and flexibility in allocating resource funds according to regional priorities. The PSC members recommended the amended document entitled Regional Orientation on the implementation of the WHO Program Budget 2018-2019 for consideration by the 67th session of the Regional Committee. The PSC was briefed on two issues from the World Health Assembly that will be considered at the 67th session of the Regional Committee. The first related to the implementation of the International Health Regulations 2005, Decision WHA 7011, by which the Director General was requested to develop, in full consultation with member states, including 3 regional committees, a draft 5-year global petition plan to improve public health preparedness and response, to be submitted to the 71st World Health Assembly in May 2018 through the Executive Board at its 142nd session in January 2018. The second briefing was on global vector control response, resolution WHA 70.16, which requests the Director General to develop a consultation with member states and through regional committees as appropriate, regional action plans aligned with WHO technical guidance on vector control. The Secretariat will provide draft documents that will take into account existing regional agreements for member states to provide inputs. I hereby acknowledge the hard work and commitment of PSC members during the tenure of my office, as chairman of the PSC. Lastly, I further wish to, on behalf of the PSC, further congratulate Dr. Tedros for his recent appointment to the pinnacle of leadership of the WHO. We wish you well, good health, long life, and success in your work. I also wish to, on behalf of the PSC, extend our sincere gratitude to the Regional Director, Dr. Moiti, and her capable team for facilitating the work of the PSC. Finally, on behalf of my country, Sierra Leone, I wish to convey our heartfelt appreciation to all of you for the tacitly expressed and practical ways in which you have empathized with us and supported us in diverse ways following the recent tragedy in our country. We are comforted by the fact that there are friends, brothers and sisters far and wide that we can rely on in good times and in bad times. I thank you for your attention.
Let me thank you very much, Dr. Thomas Samba, Chairperson of the Program Subcommittee, and also to thank your Program Subcommittee itself. You worked very hard, a lot of diligence there, and you reviewed 11 documents on public health matters of regional concern, and I think this is really commendable. But you will notice, honorable ministers and heads of delegation, that a lot of these will come in separate agenda items, a lot of these issues. So while we will discuss it now, but there will be specific agenda items for most of these as we go along. But having said that, are there any observations on the report, any comments from honorable ministers and heads of delegations? I see none. I now consider that the committee is ready to take note of the report of the PSC, and the report is noted. We go straight to agenda item number 9 on the regional strategy for the management of environmental determinants of human health in the Africa region, 2017 to 2021, document AFR/67/6. I will now give the floor to Dr. Magaran Bagayoko, who is representing the Director, Communicable Diseases, to introduce this document.
Merci, Monsieur le Président. Honorables Messieurs, Madame les ministres, chers chefs de délégation, au nom du secrétariat, j'ai le plaisir d'introduire le document référencé AFR RC 67 6 et titré Stratégie régionale pour l'action sur les déterminants environnementaux de la santé. Il est bien établi que la fraction de la maladie qui est attribuable aux déterminants environnementaux de la santé sont considérables dans la région africaine. 23% de la charge de la maladie peut être directement liée aux facteurs de l'environnement. Ces maladies incluent par exemple les maladies diarrhéiques telles que le choléra, les maladies à transmission vectorielle et les maladies respiratoires qui sont liées à la pollution de l'air. Justement, l'eau, l'hygiène et l'assainissement, la pollution atmosphérique et la pollution de l'air à l'intérieur sont les principaux facteurs de ces maladies. Dans la région africaine, nous savons que nos problèmes majeurs ou les principaux déterminants environnementaux de la santé sont l'accès à l'eau potable, à l'hygiène et à l'assainissement, la pollution atmosphérique, la gestion des déchets, la gestion des produits chimiques, les vecteurs de maladies et la santé au lieu de travail ou la santé des travailleurs. Nous savons aussi que ces risques qui sont considérés comme des risques classiques sont exacerbés par des risques tels que l'agriculture, tels que l'urbanisation, souvent galopante et anarchique, tels que la migration et tels que les activités qui font recours en ressources et en terre et en eau. L'ensemble de ces facteurs que je viens de citer sont exacerbés par la variabilité et le changement climatique. C'est eu égard à ces risques que les ministres en charge de la santé et les ministres en charge de l'environnement avaient signé une plateforme commune qui est la déclaration de Libreville. Donc, cette déclaration de Libreville était un engagement politique pour créer une alliance stratégique entre la santé et l'environnement et pour pouvoir gérer de façon concertée les déterminants environnementaux de la santé. Cependant, force est de reconnaître que, malgré les efforts que certains États ont déployés pour mettre en œuvre de façon efficace cette déclaration de Libreville, les progrès restent mitigés et variables d'un pays à l'autre. Aussi, nous savons aussi que le paysage a beaucoup changé. Aujourd'hui, avec l'avènement des objectifs du millénaire pour le développement, dont l'objectif numéro 3 a trait à la santé, et d'autres objectifs tels que l'objectif 6 qui a trait à la gestion durable des ressources en eau, l'objectif 7 sur l'énergie, l'objectif 11 sur les villes et l'objectif 13 sur le changement climatique. Nous savons aussi qu'il y a d'autres développements au niveau international. Nous savons par exemple la déclaration de Paris sur le climat. Il y a le cadre de Sendai sur la réduction des risques et catastrophes. Et nous avons aussi un engagement plus fort pour maintenant mettre à la disposition des pays des énergies ou des sources d'énergie moins polluantes. Donc, avec le paradigme de découpler le développement, c'est-à-dire nous développer en réduisant notre empreinte environnementale, en décarbonisant l'atmosphère, en réduisant l'émission des gaz à effet de serre, et aussi en détoxifiant l'environnement, en réduisant les polluants. Donc, si on prend tout cela en compte, avec la sécurité sanitaire internationale qui devient aussi une priorité sur l'agenda mondial, donc il y a lieu de faire un changement de paradigme et de proposer une stratégie qui tient compte de tous ces développements et qui soit alignée sur les objectifs de développement durable. C'est pour cela que cette stratégie a été proposée aux États membres par le secrétariat. L'objectif de cette stratégie est de réduire le poids de la santé liée à l'environnement. Donc cette stratégie sert de cadre aux États membres pour formuler les politiques et les stratégies nationales pour réduire l'impact des déterminants environnementaux sur la santé humaine. Cette stratégie se focalise sur les aspects suivants. Le premier qui est vraiment la vision stratégique, c'est le changement ou la restructuration du concept politique et institutionnel. Ce qui se traduit par la collaboration intersectorielle à tous les niveaux. Parce que nous savons que certains États avaient mis en place des groupes multisectoriels pour la gestion de la déclaration de Libreville, mais l'opérationnalisation de ces groupes a connu des fortunes diverses. Donc, nous savons que le secteur de la santé ne peut pas à elle seule gérer tous les problèmes de développement ou les problèmes de santé qui dérivent des autres secteurs. D'où la nécessité de créer une plateforme nationale multisectorielle qui est capable de gérer de façon concertée les déterminants environnementaux de la santé. Un autre aspect important est la surveillance intégrée, y compris l'utilisation des facteurs environnementaux et des données climatiques dans la surveillance des maladies, y compris le développement des systèmes de préalerte des maladies, surtout climato-sensibles. Il y a aussi un aspect important qui est le renforcement des capacités. Donc nous voyons que pour faire face aux défis environnementaux, nous devons avoir des capacités tant sur le plan infrastructurel, sur le plan technique et sur le plan institutionnel. Aussi, un domaine important proposé dans cette stratégie est l'engagement de la communauté. Nous savons que la communauté est au départ et à la fin de toutes ces actions. Donc, il est proposé de renforcer la communauté et de réduire les processus ascendants. Parce que jusque-là, tout le processus, si je prends le cas du changement climatique, a été des processus qui sont du haut, des processus verticaux. Cependant, il est temps maintenant de passer par les communautés, d'identifier leurs besoins spécifiques et de renforcer leurs capacités pour qu'ils puissent nous proposer des méthodes d'adaptation et ils en ont. Donc, ça c'est aussi une composante. Et ce que nous n'oublions pas, si nous parlons d'adaptation, nous parlons de gestion de l'environnement, il s'agit tout simplement de... Oui, il s'agit tout simplement de la prévention primaire. Et nous allons faire en sorte que l'accent soit mis sur les interventions de prévention primaire qui existent. C'est-à-dire l'eau, l'hygiène et l'assainissement au niveau des pays, la gestion de la pollution de l'air, par exemple en fournissant aux ménages les sources d'énergie domestique propres pour se réchauffer, pour cuisiner et pour s'éclairer, en aussi faisant la promotion de la santé en milieu de travail, en mettant un accent sur la prise en compte de la dimension changement climatique dans nos programmes de santé. Lorsque nous faisons par exemple nos programmes ou nos installations d'eau, d'hygiène et d'assainissement, de prendre en compte la dimension changement climatique et de faire en sorte que le secteur de la santé soit plus présent dans ce secteur. Ensuite, il y a la pollution de l'air qui sera gérée, la solution des produits chimiques et la santé au travail. Donc voilà, mesdames et messieurs, chers délégués, ainsi introduit ce document sur la gestion des déterminants environnementaux de la santé. Nous pensons que la mise en œuvre de ce document va seulement permettre au pays de réduire l'impact de ces déterminants sur la santé humaine, mais aussi contribuera à l'atteinte des objectifs de développement durable. Donc, ce document est proposé au comité régional pour adoption. Je vous remercie.
Thank you, Dr. Bagayoko. A very important document. I'll open the floor to honorable ministers and heads of delegations. Okay. I note, is it Senegal, then is it Ghana, Togo, Burkina Faso, Côte d'Ivoire, Cabo Verde, Madagascar, Gambia, Malawi, Gabon, you've written it, Ethiopia. Oh, this is quite serious. Liberia, you have written Liberia, Seychelles, South Africa, United Republic of Tanzania, Burundi, Nigeria already on the list, and Niger, you're on the list. Niger, you're already there. Right, so, and Namibia. So can we start with, people are warm now. Senegal.
Merci beaucoup, Monsieur le Président. Je voudrais, à l'entame de mes propos, présenter les excuses du professeur Aouamari Kolsek, ministre de la Santé et de l'Action sociale du Sénégal, qui n'a pas pu faire le déplacement ici, à Victoria Falls, pour les contraintes gouvernementales. Le Sénégal renouvelle ses félicitations au directeur général de l'OMS et exprime toute sa fierté d'avoir à la tête de cette illustre organisation un Africain. Il remercie encore l'OMS et les États membres pour lui avoir accordé leur confiance pour organiser la 68e session, et le Sénégal renouvelle ici solennellement toute sa disponibilité et sa joie pour vous accueillir dans son pays, le pays de la Teranga. Concernant la stratégie régionale pour la gestion des déterminants sociaux environnementaux de la santé humaine dans la région africaine 2017-2021, qui vise à promouvoir une approche intégrée de la gestion des déterminants environnementaux de la santé afin d'accélérer l'application de la déclaration de Libreville. Cette présente stratégie régionale, comme l'a si bien dit le rapporteur, s'appuie sur les progrès réalisés dans la mise en œuvre de la déclaration de Libreville et fournit des orientations aux États membres afin qu'ils puissent s'attaquer aux liens entre la santé et l'environnement dans le cadre des objectifs de développement durable. Le Sénégal partage dans une très large mesure le contenu de cette présente stratégie régionale. Toutefois, les recommandations suivantes méritent d'être prises en compte. Au niveau des interventions prioritaires, le point 20 entreprend des interventions de base des risques et des capacités. Le Sénégal suggère aussi de demander que l'OMS demande au pays de réaliser une cartographie des risques environnementaux et sanitaires et de faire une priorisation. Au niveau du point 21, renforcer les capacités infrastructurelles, techniques et institutionnelles. Le Sénégal suggère de prendre en compte, dans le cadre de l'intégration de l'éducation sanitaire et la promotion de la santé environnementale, d'ajouter les universités et écoles de formation aussi pour l'alignement des programmes académiques. Au niveau du point 22, mettre en place des systèmes intégrés de surveillance de la santé et de l'environnement. Ici, il faudrait encourager les États à mettre en place des plateformes de coordination pour le suivi des activités, pour améliorer la coordination technique, parce que ce n'est pas toujours facile de travailler avec plusieurs secteurs en même temps. Dans le cadre de la formulation des programmes de recherche, ici l'enjeu c'est de mobiliser des fonds suffisants pour mettre en œuvre les programmes. Pour cela, nos suggestions c'est d'ajouter le développement du partenariat public-privé, partenariat avec les grands laboratoires surtout, mais surtout avec les sociétés de production chimique ou bien les sociétés de construction de voitures par exemple. Au niveau du point 25, améliorer l'accès à l'eau de boisson sans risque sanitaire, à l'assainissement et à l'hygiène. Nous suggérons ici la collaboration, d'ajouter la collaboration multisectorielle, surtout avec le ministère de l'hydraulique, qui est responsable de la création des points d'eau potable, mais aussi avec les sociétés responsables de l'exploitation, de la distribution et de la mise en eau en bouteille de cette eau. Au niveau du point 26, nous pensons qu'il faudrait encourager la mise en place aussi de plateformes ou de cadres harmonisés avec certains cadres sous-régionaux tels que le SILS ou avec des autres. Voilà. Et en conclusion, nous invitons la 67e conférence de bien vouloir tenir en compte ces contributions dans l'adoption de la présente résolution, dont l'objectif global est de fournir des orientations aux États membres en ce qui concerne les liens entre la santé et l'environnement en vue de la réalisation des objectifs de développement durable. Je vous remercie de votre attention.
I want to thank Senegal because of those recommendations and observations on training, technical collaboration, PPPs, and the multi-sectoral approach. Ghana, you have the floor.
Thank you, Chair. Since Ghana is taking the floor for the first time, allow me to congratulate the government and people of Zimbabwe for hosting this session of the Regional Committee. The beautiful scenery and warm reception you have given us will leave a lasting impression. The delegation of Ghana also wishes to commend the Secretariat for the comprehensive and clear-cut reporting on this agenda item, as well as the attendant regional strategy for the management of environmental determinants of human health in the African region 2017-2021. Mr. Chair, Ghana wishes to make two very pertinent observations as follows. One, over the years, a sector that has not been strongly emphasized in the discussion of the environmental determinants of health is education. We therefore welcome the areas of priorities related to health education and environmental promotion in the curricula of training institutions. The role of community leadership and knowledge, as well as the recognition of academia. It is crucial to see education not only as a solution to the problem, but also as a preventive tool, and to fully harness the preventive potential of education in averting diseases attributable to environmental risks. The related interventions should be wider and cross-cutting and should start as early as primary school. 2, the challenges of chemical management and waste and the envisaged impact on health is more than we are predicting. While the adoption of the strategic approach to international chemicals management presents a step in the right direction, it should, however, be noted that the participation of member states from the African region in this discussion was limited. With this adoption and subsequent adoption of the regional strategy before us, spells out roles and responsibilities for member states. Ghana, like most states in the region, is still lagging behind in the regulatory capacities and frameworks needed to mitigate the incidence of chemicals and waste in basic sustenance like our food and water. We require targeted technical assistance and a regional orientation about the environment being our very source. But a very bulk of addressing this issue will be the political will to undertake our roles and responsibilities. In Ghana, at the moment, the government has taken a bold step to stop illegal mining, which is polluting our water bodies and the environment in general. And we believe this will go a long way in stopping the rampant destruction of the environment, which eventually affects our health. I thank you for your kind attention.
Thanks, Ghana, for pointing out the issue of training and education, and also chemical management in terms of regulatory framework within the Africa region. I think that those are very important issues. Côte d'Ivoire, you have the floor.
Merci, Monsieur le Président. La Côte d'Ivoire félicite le secrétariat du comité régional pour son rapport sur la stratégie régionale pour l'action sur les déterminants environnementaux de la santé humaine dans la région africaine 2017-2021. Dans le cadre des principes directeurs de la stratégie régionale en matière de santé environnementale, la Côte d'Ivoire a initié plusieurs actions, entre autres la mise en place d'une plateforme nationale prenant en compte tous les domaines pour la prise en compte des questions liées à l'environnement et à la santé. La création d'une direction, la direction de l'hygiène publique, la santé et l'environnement au sein du ministère de la Santé, la validation du plan national d'adoption du secteur de la santé au changement climatique, la sensibilisation de la population aux impacts négatifs sur la santé des facteurs environnementaux, la signature et le soutien de la coalition santé-environnement au changement climatique, entre autres. Cependant, plusieurs défis restent à relever. Il s'agit entre autres du renforcement de la recherche sur la vulnérabilité de la santé et de l'environnement au changement climatique, du renforcement de la vigilance et de la surveillance contre la survenue des épidémies et des maladies tropicales endémiques, entre autres la dengue, le paludisme, la fièvre jaune, le choléra, l'onchocercose et la trypanosomiase, de la gestion écologique rationnelle des produits chimiques, des déchets sanitaires, ménagers et industriels, et de la mise en place d'un mécanisme de financement durable capable de soutenir les activités de promotion de l'hygiène et la réduction de l'impact au changement climatique sur la santé publique à travers un plan 2016-2020. La Côte d'Ivoire félicite les partenaires pour toutes leurs initiatives en faveur de la santé des populations, tout en s'engageant à accélérer l'élaboration et la mise en œuvre d'une politique de santé et environnement. Elle sollicite un appui des partenaires pour faire face à ces défis. Elle soutient la stratégie régionale pour l'action sur les déterminants environnementaux de la santé humaine dans la région africaine 2017-2020. Monsieur le Président, je voudrais vous remercier pour la parole donnée.
Thank you again, Côte d'Ivoire, for pointing out issues and the importance of climate change and the surveillance of epidemics, biological waste, and financing for hygiene. Burkina Faso, you have the floor.
Merci, Monsieur le Président. Le Burkina Faso aussi remercie le secrétariat de l'OMS pour la préoccupation soulevée sur les déterminants de la santé, en particulier les déterminants environnementaux, et donc remercie le secrétariat pour la qualité des documents partagés. Nous avons trois préoccupations à soulever par rapport à ce document. La première préoccupation, c'est un peu toute la description des déterminants dans laquelle rien n'est dit sur l'apport des animaux dans la dynamique d'émergence des germes microbiens puisque nous savons tous que 80% des nouveaux germes que nous rencontrons au quotidien viennent des animaux. Nous savons tous que nous nous orientons tous sur une seule santé qui implique le monde animal, et nous savons tous que toute la dynamique autour du monde animal alimente la résistance aux antimicrobiens. Donc il serait important de clairement faire ressortir l'ensemble de cette contribution du monde animal à cette dynamique environnementale. Aussi, dans notre région sahélienne, vous savez tous que notre préoccupation majeure, c'est la désertification, c'est les feux de brousse et les conflits qui entraînent des déplacements de population qui, l'ensemble, créent des problèmes environnementaux qui contribuent à détériorer la santé de la population. Et l'ensemble de ces préoccupations doivent être capturées et spécifiées pour notre sous-région. Donc ça, c'est la première préoccupation. La deuxième préoccupation est en rapport avec comment, par quel mécanisme nous allons travailler à mieux théoriser et à mieux développer les stratégies de réponse aux déterminants environnementaux de la santé. Notre contribution est de mieux mettre l'accent sur la science des risques, ou la science du risque, qui permet de renforcer les capacités des pays à évaluer quels sont les différents risques environnementaux par pays et quelles réponses en fonction de tels risques et en fonction de telle probabilité de survenue du risque dans le pays. Et donc toute cette science du risque n'est pas bien capitalisée dans les compétences dans les pays, et il serait bien de travailler à voir comment développer l'ensemble des compétences de caractérisation des risques et de renforcement des stratégies de réponse aux risques spécifiques par pays. Le Burkina, par exemple, envisage de créer très bientôt une agence nationale de sécurité sanitaire de l'alimentation qui capture tout ce qui a été dit sur l'eau, l'environnement, l'hygiène. L'agence nationale de sécurité sanitaire aussi de l'environnement pour tout ce qui a été dit et du milieu du travail. Et donc, dans cette agence aura le rôle de théoriser et de développer les capacités nationales en matière de sciences du risque et de réponse à ces défis environnementaux pour la santé. Donc ça, c'est les deux préoccupations. Maintenant, une question, c'est en rapport avec ce qui a été dit, ce qui concerne le caractère, la difficulté de faire travailler en multisectoriel les uns et les autres sur ces déterminants environnementaux, où le présentateur a dit que les pays ont connu des fortunes diverses et il a recommandé de créer une plateforme nationale multisectorielle pour gérer les questions de santé et environnement. Je n'ai pas compris la logique de critiquer qu'il soit difficile de travailler en multisectoriel et de recommander de mettre en place une plateforme multisectorielle. Comment peut-être travailler en multisectoriel devrait être la réflexion à mener pour voir à quel niveau, à quelle échelle, qui est au niveau de chaque pays le mécanisme essentiel. Est-ce que c'est au niveau présidentiel, comme l'approche politique a été utilisée dans les différents pays pour lutter contre le sida? Est-ce que c'est au niveau du Premier ministère? Parce qu'on s'est rendu compte qu'au niveau des départements ministériels individuellement, il est vraiment difficile de mobiliser les autres. Le Burkina a l'expérience des cadres de dialogue sectoriel où, aux différentes réunions, très peu de capacités de haut niveau des autres ministères contribuent. Et le secteur de la santé se retrouve chaque fois un peu isolé pour réfléchir sur les questions de santé qui sont particulièrement multisectorielles. Et donc, il faut réellement qu'on voit et on développe le mécanisme qui permettrait de bien engager peut-être des niveaux supérieurs présidentiels au premier ministériel pour engager les gens sur les questions multisectorielles. Et je vous remercie pour la parole donnée au Burkina Faso. Merci, Monsieur le Président.
Thank you, Burkina Faso. Your concerns, I think, have been noted as well, especially the issue of animal dynamics and One Health concept and the issue of desertification and field fires. But the signs of risks that you emphasize are also important. The Gambia, you have the floor.
Thank you, Mr. Chairman. The Gambian delegation would like to thank the Secretariat for developing this strategy. This proposed strategy seeks to strengthen an integrated approach to the management of environmental determinants of human health in order to accelerate the implementation of the Libreville Declaration. We are also aware that this strategy builds on progress made in implementing the Libreville Declaration and provides guidance on addressing health and environmental linkages within the context of the SDGs. It is unfortunate that the situational analysis conducted prior to developing this strategy revealed that the region fell short of the Millennium Development Goals target of 74% of the population with access to safe drinking water, and also did not meet the MDG target of 62% access to sanitation. However, it is worth noting that significant gains have been made in these areas. Access to safe drinking water increased from 48 to 68% over the MDG era, and the proportion of the population using improved sanitation facilities also increased from 24 to 30% during the same period. In its efforts to implement the Libreville Declaration, the Gambia established the multi-sectorial country tax team and conducted the situational and needs assessment. Due to lack of funding, due to lack of technical support, we have, however, not been able to complete the process in the health and environmental leakages data system tool to develop the SANA report. I would like to take this opportunity to thank WHO for supporting the Gambia during this process. We are, however, not only committed to fully implementing the Libreville Declaration as an approach to addressing the environmental determinants of human health, but also preparing a national plan of joint actions as stipulated by the Luanda Commitment. The proposed regional strategy for the management of environmental determinants of human health in line with the Global Health Agenda, and which also takes into consideration international environmental health priorities, provides enough guidance to member states for reducing the burden attributable to environmental determinants. In conclusion, the Gambia supports the proposed regional strategy and requests the Regional Committee to endorse it. Thank you.
Thank you, Gambia, for that endorsement. Cabo Verde, you have the floor.
Bom dia e muito obrigada, Sr. Presidente. Queremos cumprimentar o Sr. Diretor-Geral da OMS, a Sra. Diretora Regional, e também agradecer o acolhimento da República de Zimbábue a esta atividade. Também queremos agradecer o trabalho e felicitar o trabalho do Secretariado sobre este tema que é muito pertinente. Realmente há necessidade de se reforçar a abordagem integrada na gestão dos determinantes ambientais da saúde humana. E queremos reforçar aqui a intervenção também da Burkina Faso na ótica de uma só saúde, a saúde animal, incluindo a saúde animal e ambiental. Cabo Verde, como sabem, viveu nos últimos anos duas epidemias importantes, de dengue em 2009 e de zika em 2015 e 2016, e tem tido várias ameaças de epidemias que, apesar de todos os esforços que o Ministério da Saúde tem feito, sentimos necessidade realmente de termos ferramentas para implementar os mecanismos e reforçar as capacidades de intervenção na área de saneamento, ambiente, saúde animal, gestão da água potável, etc. Neste momento, e com o apoio da OMS, o país está a preparar um plano de avaliação dos riscos numa ótica multissetorial, para que haja um compromisso de todos os parceiros, ministérios, organismos não governamentais, organismos internacionais, etc., para podermos enfrentar melhor as vulnerabilidades do país, porque como sendo um país insular, as vulnerabilidades são várias e que têm a ver com, desde a globalização, a questão também das mudanças climáticas. Daí que continuamos a contar com o apoio da Organização Mundial da Saúde para enfrentar esses desafios e outros, tendo em conta os parcos recursos do país. Assim, nessa ótica também, nós apoiamos essa estratégia regional para a gestão dos determinantes ambientais da saúde humana. Obrigada, Sr. Presidente, por me ter dado a palavra.
Thank you, Cabo Verde, for those observations. Liberia, you have the floor.
Thank you, Mr. Chair. Liberia wishes to express thanks and appreciation to the Secretariat for this important and critical agenda, most especially in the wake of what has just transpired in Sierra Leone. We wish to reiterate our sympathy to our neighbor for the loss they have sustained. In light of what Sierra Leone has experienced, which is reminiscent of what transpired in the Mana River Basin 3 years ago, and sent a strong message to the world that disease has no borders, hence should not be taken for granted, for which we have elevated emergency preparedness at all levels. This past incident is an affirmation that we should begin to work assiduously in the management of our environment. Let me remind us, as elucidated in the following SDGs 11, 13, 15. Secondly, health education and building trust are keys that will unleash the strength of our people in protecting and taking charge of their health. Therefore, the immediate process should begin from the communities and at all levels of the school system. A strong political will to take critical action in curtailing environmental determinants, yet innovatively leveraging resources in diversifying other means that will benefit the environment to improve human health is critical. Furthermore, it behooves us to pay heed to the passionate plea of our dear brother, the Honorable Minister of South Africa, on the contributors to the burden of NCD, which correlates with air pollution, etc. Cognizant of these goals and working together as a region could help tremendously in reversing future catastrophe. Hence, Liberia supports the approval of Agenda Item 9 with a plea that a roadmap is carved up that could be used to measure progress within our region. Thanks for the opportunity.
Yep, thank you, Liberia, for suggesting a roadmap for progress and also the emphasis on health education. Madagascar, you have the floor.
Merci, Monsieur le Président, de nous avoir donné la parole. Madagascar félicite le secrétariat du Comité régional de l'OMS pour la qualité de ce document sur la stratégie régionale sur les déterminants environnementaux de la santé humaine dans la région africaine. Madagascar est une grande île qui est une zone à risque climatique très important et qui subit des conséquences dévastatrices de cyclones et de El Niño. Les ressources nationales n'arrivent pas à satisfaire le besoin pour le redressement sanitaire. Madagascar a adhéré à la déclaration de Libreville en santé et environnement en 2008 et dans notre pays, les maladies climato-sensibles constituent les 10 premières causes de morbidité et de mortalité hospitalière. On constate qu'il y a une tendance à la hausse des pathologies cardiovasculaires et cancéreuses et un fort poids d'épidémies de maladies vectorielles. Les principales réalisations de Madagascar sont surtout la mise en place du groupe de travail en santé et environnement depuis 2010 et l'élaboration des documents de référence politiques et stratégiques, dans notamment le plan national d'action intégrée en santé et environnement, le plan national d'adaptation du secteur santé au changement climatique. Les enjeux et les défis sont la gestion l'amélioration des principaux déterminants environnementaux tels que l'accessibilité en eau, assainissement et hygiène, y compris la gestion des déchets pour la population en général et pour les formations sanitaires en particulier, pollution de l'air, du sol et de l'eau par des produits polluants biologiques et chimiques d'origine industrielle et par les ménages. Il n'est pas à négliger aussi le renforcement des connaissances et des compétences des acteurs locaux et de la population. Les activités que nous menons consistent à l'intégration des activités en santé, changement climatique et environnement dans l'Observatoire national sur l'adaptation au changement climatique, l'intégration du volet santé dans le processus d'élaboration du synopsis et du plan national de réduction de l'utilisation du mercure dans l'exploitation artisanale de l'or, mise en place de l'Observatoire national intégré en santé et environnement pour la gestion rationnelle des produits chimiques et enfin la mise en place des formations sanitaires amies de WASH et gestion des déchets médicaux à Madagascar. Je vous remercie de votre attention.
Thank you very much, Madagascar, for those observations. Malawi, you have the floor.
Thank you very much, Mr. Chairman, for giving me the floor. The government of Malawi recognizes that environmental health services have the greatest impact on people whose health status is already at risk. Therefore, environmental health must address the societal and environmental factors that increase the likelihood of exposure to hazards and diseases. Environmental health has been recognized as one of the most important functions in a drive to improving human health. Malawi is intervening in key thematic areas for environmental health, and these include food safety and hygiene, water and sanitation, health and safety, vector and disease control, and also emergencies and climate change and health. Therefore, Honorable Chair, we are in support of this proposed strategy. There is, however, an observation made on page 7 of the document, which is looking at the roles and responsibilities. So bullet number C, which talks about promoting inter-country stakeholders. Here I would propose that this dialogue has to be within and between countries, not just inter-country as it is put here. And just to support the other member states that have spoken before me, multi-sectoral collaboration is critical. Unfortunately, the health sector inherits failures of other sectors. Therefore, we have to make sure that we have this collaboration with other sectors. And as the health sector, we have to take the lead. Thank you very much, Honorable Chair.
Thank you, Malawi, for observing that inter-country and also between and among countries. I think that is an important observation. Niger, you have the floor.
Merci, Monsieur le Président. Permettez-moi, avant tout propos, de vous adresser les encouragements de Monsieur le ministre de la Santé publique, Dr Idi Ilyas Oumenassara, et de vous assurer de sa détermination à œuvrer aux côtés de ses pairs en charge de la santé et de l'OMS pour accomplir le nouveau progrès de la santé en cette ère du développement durable au bénéfice de notre continent et de l'humanité tout entière. Monsieur le Président, il n'est pas assez de rappeler que notre région subit la double charge des maladies transmissibles et non transmissibles qui sont dans une large mesure attribuables au changement climatique et aux défis environnementaux. Les différents événements qui ont frappé notre région, à savoir la dengue, la fièvre de la vallée du Rift, l'infection à virus Zika, la fièvre jaune, toutes à transmission vectorielle, constituent la preuve de l'impact négatif des facteurs environnementaux sur la santé humaine. Ceci nous commande une réponse à hauteur de ces défis. La présente stratégie élaborée et soumise à notre adoption est à saluer et représente un cadre dans lequel les États, la société civile et les partenaires se doivent d'entreprendre des actions multiformes, cohérentes et intégrées sur les déterminants environnementaux de la santé. Monsieur le Président, pour cela, nous demandons et exhortons l'OMS à tisser un partenariat fort avec les autres institutions du système des Nations Unies en charge du climat et de l'environnement, et aussi à tirer profit des différents engagements internationaux, en particulier l'accord de Paris sur les changements climatiques de 2015 et le cadre de Sendai pour la réduction des catastrophes 2015-2030, pour mobiliser des ressources en vue d'accompagner les États. Pour conclure, Monsieur le Président, le Niger soutient vivement la stratégie régionale pour l'action sur les déterminants environnementaux de la santé humaine et recommande son adoption. Je vous remercie pour la parole donnée au Niger.
Thank you, Niger. Gabon, you have the floor.
Merci, Monsieur le Président. Le Gabon félicite le secrétariat pour la qualité du document d'orientation et soutient la stratégie régionale sur les déterminants environnementaux de la santé humaine dans la région africaine 2017-2021. En effet, le gouvernement gabonais est fermement engagé dans la bataille contre les changements climatiques et prône des actions concrètes dans ce domaine. Dans ce sens, depuis la déclaration de Libreville en 2008, notre pays a réservé 15% de sa forêt pour contribuer à la reconstitution de la couche d'ozone. L'Agence gabonaise d'études et d'observation spatiale, AGEOS, a été créée pour surveiller, mesurer et cartographier l'impact des changements climatiques sur les populations humaines et animales. Tout récemment, un Conseil national d'attribution des terres multisectoriel a été créé pour que toutes les interventions gouvernementales se fassent dans le strict respect de l'environnement pour un développement harmonieux et durable. Aussi, le Gabon soutient-il l'idée de faire de la cartographie des risques environnementaux et l'évaluation des capacités des États membres une priorité dans le programme d'action de la région africaine. Enfin, comme vous l'avez souligné, 23% de la charge totale de morbidité de la région africaine sont imputables aux risques environnementaux. Aussi, appuyons-nous l'intensification des interventions primaires à faible coût mais à haut impact sur le contrôle des maladies liées à l'environnement. Nous vous remercions.
Merci beaucoup, Gabon. Nigeria, you have the floor.
Thank you very much, Mr. Chairman. I want to thank the Regional Committee for this excellent document on the environmental determinants of human health. This is a very welcome document, and I also want to appreciate the contributions from all previous speakers who have so eloquently highlighted the various traditional risks to the environment, especially regarding climate change, water, sanitation, hygiene, desertification, vector control, food safety, etc. We align ourselves to the strategy of the Regional Committee and WHO. However, I want to draw the attention of the Regional Committee and member countries, particularly those joining the League of Oil Producers, to the new hazards creeping in on us from oil exploration, particularly also oil spills and gas flaring. There are several risks involved in this industry. The spillage and the act of drilling itself unleashes into the environment hydrocarbons and heavy metals, which have a severely deleterious effect on the flora and fauna, and also affect
drinking water sources. In the Niger Delta, data is still being collated, but anecdotal evidence suggests the spike in cancers and in children born with deformities, along, of course, with the high increase in upper respiratory tract infections. It is important that those who are joining and particularly developing the oil industry develop an awareness for the hazards and work closely with petroleum companies to strictly monitor activities, to limit gas flaring, control oil spills, and prepare for remediation activities, in addition to installing strong regulatory mechanisms. Without these factors, we shall be dealing with problems that are going to be following on the oil industry. Thank you.
Thank you, Nigeria, for highlighting that. The petrochemical industry is a powerful industry, almost as powerful, or if not more than Coca-Cola. So I think you really need to look at that and put strong regulation. Ethiopia, you have the floor.
Thank you, Mr. Chairman. The Federal Democratic Republic of Ethiopia would like to express its sincere appreciation to the WHO Regional Secretariat for bringing up this timely and relevant agenda for action. Recognizing the fact that about a quarter of all premature deaths in the African region are attributed to an unhealthy environment, understanding that the African region did not meet the emergency targets for sanitation and clean water, noting that the region is facing significant health consequences due to indoor pollution due to domestic use of solid for household consumption, and recalling that the observed growth in industrialization and urbanization in Africa has a potential risk of resulting unprecedented environmental pollution. The government of Ethiopia is an advocate of green economy and is committed towards all international agreements to protect and promote the environment. The Ethiopian health sector also addressed problems related to indoor pollution through our health extension program. Households are encouraged to use efficient and environmental friendly energy source which can protect their health at the same time. In order to strengthen the institutional mechanism for integrated environment and health interventions, the Federal Minister of Health of Ethiopia has developed two strategic documents in 2016. These are the National Hygiene and Environmental Health Strategy and Integrated Urban Sanitation and Hygiene Strategy. The health and environment sectors also aligned strategic plans and policy documents to help facilitate multi-sectoral coordination, as the government policy is to build climate-resilient green economy. In line with this, the government of Ethiopia is implementing zero liquid discharge to the environment from flourishing industrial parks. Secondly, the government is also expanding renewable energy sources, including the 6,450 megawatt generating capacity of the Grand Renaissance hydroelectric power. And it's also working hard in afforestation and reforestation, which results in an increase of the natural forest from 3% to 15% in about 2 decades. Recognizing unhealthy environment as a major contributor to the majority of communicable and non-communicable diseases in the country, the government of Ethiopia welcomes the regional strategy for the management of environmental determinants of human health in the African region 2017 to 2021 and urges the Secretariat support toward this unexpedited implementation. I thank you.
Thank you, Ethiopia. Seychelles, you have the floor.
Thank you, Chair. Seychelles supports this proposed strategy, which is well conceived, and in particular would like to emphasize and endorse the approach on health leadership for the environment, as well as the multi-sectoral approach. I think, though, Mr. Chair, there is one area that could be emphasized and given more explicit visibility, and that is the role of the environment as a determinant of good health. The emphasis is on how the environment problems lead to health problems, but I think we need to recognize that the environment as a source of sustaining life and enhancing health and human well-being should be emphasized. In Seychelles, we are very much aware of the negative impact of the environment, be it climate change, unprecedented flooding, or more recently, a prolonged outbreak of dengue fever. But we also are aware that the environment is a source of life, the source of good nutrition, and it has been mentioned, the sun, the wind, and water can be a source of renewable energy and less dependence on more polluting forms of energy generation. So I believe that emphasizing this positive view of the environment will enhance the document and our approach. Because at the end of the day, when leaders value the environment, when environmental impact of all developmental programs and projects are emphasized, and where citizens become protectors of the environment, that together with our approach and the measures we take to protect and to mitigate the effects of bad environment will be part of our good strategy. Thank you, Chair.
Thank you, Seychelles. I think approach to look at how the environment promotes good health as well, among other things. South Africa has the floor.
Thank you very much, Chairperson. South Africa would like to thank the Secretariat for the comprehensive and well thought of strategy. It is indeed a good document. South Africa is fully implementing and in full support of the International Health Regulations 2005, as well as the Libreville Declaration, as endorsed by the Luanda commitments taken by African health and environmental ministers. These are seen as strategic environmental health-related international prescripts that can guide African states towards meeting the Sustainable Development Goals 2030, understanding the proven relations between conditions of environment and human health. Regarding the need to meet the 2019 milestones of the strategy, South Africa agrees with the set targets, considering the following. 1, the establishment of a multi-sectoral country task team and develop national plans of joint actions will be by far enhance health and environmental efforts to improve human health. It should, however, be ensured that all relevant stakeholders are involved. Number 2, it has been proven that water safety is a key element of good hygiene and improved human health. Therefore, development of a national framework for water safety plans and implementing such plans by countries will go a long way in improving general health. Number 3, with vector-borne diseases on the rise and exacerbated by impacts of climate change, it is more relevant that member states should conduct and or update vector control needs assessment for an informed response to vector-borne diseases. Again, South Africa supports the 2021 targets, but just want to caution that there's going to be a lot of financial implications, which obviously countries will have to incur. Chairperson, the increased use of chemicals domestically in industries and or agriculture establishment increases the risk of chemical poisoning in our country. We are painfully aware that nations have to be fed, but on the other hand, we are also cognizant of the problems that agricultural establishment and industries are causing. All countries should indeed have at least one functioning poison control center or toxicology unit that meets WHO minimum requirements depending on their geographical span of the country. South Africa has already 3 operational poison information centers that manage and respond to and keeps database of chemical poisoning. Lastly, Chairperson, the development of national policy instruments for action on workers' health is also key, as workers are the backbone of the country's economic growth, and their production is directly related to their state. Their productivity, is directly related to their state of health. Regarding the scaling up of cost-effective primary prevention interventions, we agree with the identified principal areas of focus on the discussion points within the document. In addition, we acknowledge that amongst all WASH interventions, that means water, sanitation and hygiene, hand washing with soap alone shows the greatest reduction in diarrheal morbidity, over 40%, Chairperson, and prevents 30 to 47% of childhood diarrhea and 23% of respiratory infection. Hand washing with soap also prevents infection in HIV/AIDS positive individuals. New WHO data shows that if you implement water, sanitation, and hygiene interventions together, the synergies will deliver a 12% additional reduction in diarrheal disease over implementing them separately. Not only is hygiene promotion the most impactful intervention in water, sanitation, and hygiene, but it has also been identified as one of the most cost-effective child survival interventions. South Africa has again, as an attempt to ensure uniformity and guide provincial and local governments, developed a national environmental health norms and standards and promulgated them in 2015. This document appears to have aligned with and already addressing the proposed regional strategy for the management of environmental determinants of human health in the African region 2017-2021, and authorities responsible for implementing any of the environmental health elements are being audited annually based on the norms and standards documents, and significant improvements in environmental health service delivery are already being seen. In the light of the above, South Africa takes note of the proposed regional strategy for the management of environmental determinants of human health in the African region 2017-2021 and supports the adoption thereof. Thank you, Chairperson.
Thank you, South Africa, for those pertinent issues. It's true, hand washing is important, especially when we're here where we are. Please wash your hands frequently, because this is where we pass in a lot of these respiratory flus. So as often as possible, but with water and running water and soap. But you pointed out the issue of workers' health, the chemicals in agriculture, water safety plans, multi-sectoral but relevant stakeholders, and I think vector control needs. I think those are very important issues. Thank you, South Africa. United Republic of Tanzania, have the floor.
Thank you very much, Chairperson. United Republic of Tanzania expresses its gratitude to the Secretariat for preparation of the regional strategy for the management of environmental determinants of human health, which have significantly become a threat to public health, as many diseases that are highly sensitive to changing temperatures and precipitation have increased burden to the health sector. An integrated approach is important in addressing these determinants, and we believe this strategy will thus accelerate the implementation of the Libreville Declaration and attain the SDGs. Chairperson, allow me to share with honorable ministers that since the adoption of the Libreville Declaration in 2008, a number of activities have been initiated in Tanzania, which include the formation of a multi-sectoral technical working group, which addresses environment and health, the National Action Plan for Workers' Health 2017-2021, as well as the National Program for Protection and Safety of Workers in the health sector have been developed. In addressing the issues of water and sanitation, there is an ongoing national sanitation campaign which has resulted in increased households with improved toilets from 11% in 2013 to 35% in 2016. However, 7% of the households in Tanzania still practice open defecation. Chairperson, in addressing adverse effects to health and the environment by chemicals, we have already established and operationalized the National Poison Control Center. Also, the Environmental Management Act is in place to control air pollution. Of course, we do still have challenges. Chairperson, the operationalization of this strategy necessitates countries to strengthen coordination, which has already been highlighted by previous speakers, intersectoral collaboration, and the mode of operation to ensure that there is coherency in implementation of activities and the linkage between health and environment. Chairperson, Tanzania welcomes the 2017-2021 Regional Strategy for Management of Environmental Determinants in Human Health as an important strategy, and we believe that the strategy has well addressed management of environmental determinants in human health and will also be a linkage with health and environment within the context of the Sustainable Development Goals. I thank you very much, Chair.
Thank you, my sister. We have got 1, 2, 3, 4, 5 member states that still want to contribute, and I understand a few NGOs as well want to contribute thereafter. Then, of course, we'll have a response from the Secretariat. So I suggest that we go for tea now and then come back and resume the debate. So let's come back at 11:30. 11:30. I think it's good time. 11:30. Thank you very much. I want my Dr. Gwinji, where are you? Please, if you could make your announcement.
Thank you, Honorable Chair. Honorable Ministers and heads of delegation, we are now distributing the boat tickets for the boat cruise that will happen late this afternoon. We do have a boat which is large enough to carry 150 people. It has got 3 decks. So the tickets that we are distributing are in 3 colors. The white deck is the signature deck, and that is largely for ministers and some of the heads of delegations, because the capacity at the very top is only 34. Then the second deck carries more people. You will get blue tickets for that. That's for the second deck. And then the third deck has even more space, and you will get a yellow ticket for that. So please keep these tickets. They are the entry into the boats. We finish at 15:30. By 1600 hours, there will be shuttles organized for the 150 people with tickets to be taken to the jetty where you will board the boat. Thank you very much.
Yeah. In spite of all that, now let's go for tea and come back at 11:30. Thank you. Thank you, Dr. Gwinji.